Minister, can I start by saying that we are entering into a critical phase in the fight against COVID, and in my view this can be the quarter, this can be the phase in our fight that we can fight back and win and give people hope that over the next number of months, if we start to get things right, we can see the easing of restrictions as we move into the third quarter of this year. But for that to happen, Minister, the state has to get its part right. The contract that we made with people was that they would abide by very tough restrictions, and they have been doing so now for some time, and that the state then would step up its responsibilities and make sure that what's under their control they would get right. And in areas of test and trace, of travel and quarantine, and indeed on the vaccine rollout, it has to be said we fell short in the first quarter, Minister. So to have any chance of winning the battle against COVID, and you say that yourself in your opening statement, in the next quarter of this year, we have to get all of those basics right. So I have a number of questions, if I can put them, Minister. My first question is just if you have the numbers here. So what is the numbers of vaccines which will have been received by the state and administered by the end of March, by the end of the first quarter this year?
Thanks, Deputy. And can I acknowledge your comments on this being the start of a period of hope? I think we all obviously have a job to do here, but I think we would speak as one in looking to the coming quarter as one of hope, as vaccines roll out, as you say, as cases are reduced, and as we can begin to have a conversation, the conversation we all want to have about returning to normality. In terms of testing and trace, travel and vaccines, we obviously will just have to disagree or agree to disagree. The testing and tracing programme is very comprehensive. We have one of the highest capacities around. We compare very favourably. Our international border measures are some of the most comprehensive, now the most comprehensive in the European Union. And on the vaccine programme, I think while it hasn't, as with any vaccine programme anywhere in the world, of course there have been things that we need to learn and do better, but the vaccine programme, I think, has gone well. So in terms of the numbers, for the end of this quarter, which is in about 5 days' time, if the deliveries come in over the next 5 days, we're expecting significant deliveries in the next 5 days or so. So we don't really want to get caught up in, you know, is it the last week of March or is it the first week of April? But the contracted deliveries are for the end of March, and we would expect to receive in excess of 1 million, in excess of 1.1 million doses. The target then is to administer those doses as they come in. Approximately 95% of vaccines are administered within 7 days. And then to your question on the next quarter, so for April, May and June, the delivery schedules are such that we would expect to receive in excess of 1 million vaccines per month.
And Minister, so the 1.1 million is short of what we were expecting, so obviously that's down to the shortfall in the AstraZeneca vaccines. Can you give us a guarantee that's going to be caught up on in quarter two? So whatever the shortfall was, which is a few 100,000 doses of the vaccines, which is quite significant, mainly on the AstraZeneca side, is that going to be caught up on in the second quarter of this year?
Thanks, Deputy. So the shortfall, if everything comes in the next 5 days as contracted, the shortfall would be less than 100,000 doses. But obviously we want everything that has been committed to. And as we have discussed on several occasions, AstraZeneca has not to date lived up on that. So the shortfall will be, somewhere, rather than 1.2, it'll be 1.1 or thereabouts. But it is meaningful. It does matter. And we are engaged very, very closely, and we fully expect, to your question, AstraZeneca to make good on its full deliveries.
But Minister, I have to point out that the projection that we were given a number of months ago was 1.4 million doses. It was then reduced to 1.2, then 1.1. So it's a bit more than 100,000. So what I'm asking is, the vaccine doses that were previously committed to, that were part of the advance purchase agreements that didn't arrive in the first quarter of this year, are we going to see all of those made up in the second quarter? Or are we going to see a continued shortfall as we move into the second quarter?
Thanks, Deputy. So we want all of the deliveries from AstraZeneca as originally committed to. As we'll all be aware, there's very intensive discussions going on at an EU level with the EU Council and the EU Commission on that. I can tell you that as of right now, AstraZeneca have not committed to the European Commission that it will fulfil its original obligations. Obviously, this is something that we're not happy with, the European Commission is not happy with, and we are continuing to push hard for as much vaccine supply as possible, because that's what the Irish people deserve.
So the bottom line here, Minister, is that, and that's down to the relationship between the European Commission and AstraZeneca, but we're not going to see that shortfall made up. That's what I'm hearing. And that's because we're not going to get the vaccines that were committed by AstraZeneca, which is deeply frustrating and it is deeply disappointing. Minister, what people want to know from your perspective is that you can get right what's in your remit and under your remit. And there's two questions I want to put in relation to that. You talked earlier about testing and tracing and saying that we can agree to disagree. I have to say, Minister, that I've never believed we've got it fully right, because testing and tracing has to be used to hunt down the virus and stay ahead of it. Public health experts, many of them have written in our national newspapers, have been pointing out the same issues I've been raising time and again. We simply don't have the capacity. We need thousands of contact tracers if we really want to do the deep retrospective contact tracing that needs to be done. Last November, it was committed to by you and your government that we would have deep retrospective tracing to get to the source of an infection and the source of an outbreak, and to look back over 9 days and not 48 hours. Has that happened? Is it going to happen? And how robustly is that going to happen? And can you also ask, today as we sit here, how many contact tracers are employed in the HSE doing contact tracing, and how many of them are doing the type of deep retrospective contact tracing which is necessary? And secondly, in relation to the vaccine rollout, can you give us the assurances, Minister, today, that as we see a ratcheting up of the administration of the vaccines, and it is good news that we'll have 1 million doses coming in the second quarter, of course it is, but what people will want to know is that you can get the rollout right and you can get the administration side right. So do we have the staff to be able to make that happen?
Thanks, Deputy. Just on a quick point of clarity, so in the second, it's 1 million doses per month. So actually, over the second quarter, it'll be approximately 3 million rather than 1 million, which is very, very positive. So the answer to your question is yes. It's exactly the question that I've been putting to the HSE repeatedly. We're expecting a very high volume of vaccines coming in now in the next number of days. For April, we're not looking at an incremental increase. We're looking at a step change in the number of people being vaccinated. Even as shortly as yesterday, Deputy, I met with the HSE management, and again we went through this, and again I asked, are we ready for a step change in April to significantly increase in the GP clinics, in the testing centres? And the answer is yes. So I am fully expecting that come the first week of April, we're going to see the kind of increase that we all want. Just in terms of testing and... are you out of time?
My colleague was coming in.
Yeah,
sorry.
okay, I can revert. Okay, thank you.